With the passage of the Education for All Handicapped Children Act, or Public Law 94-142, and the movement towards inclusion, educational options for students with hearing impairments have expanded significantly in the past 30 years. Students with hearing impairments are increasingly attending public schools and being educated in the general education classrooms with their peers. Other developments have changed the classroom experiences of students with hearing impairments in the last 3 decades as well. For example, with the advent of neonatal hearing screenings and technological advances in cochlear implants, more children are being served in the general education classrooms each year. For students who receive services for deaf or hard of hearing, the shared characteristic is some degree of hearing loss. The extent to which the hearing loss impacts a student's expressive and receptive language may determine the extent to which it impacts a student in the school environment. As you have already learned, the degree of a student's hearing impairment can be measured accurately through tests that determine the intensity level in decibels that the student can detect at each of the range of frequencies. This is important information as the type and level of support required will depend on each individual student's needs. In the IDEA, there are 2 categories in which children who are deaf and hard of hearing can qualify for services. One is the category of hearing impairment, and the other is the category of deaf. The definitions are rather straightforward. Hearing impairment is defined by IDEA as an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance. Deafness is defined as a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing with or without amplification. One has to go into the regulations to get a more operational definition, and the federal regulations stipulate that generally only children whose hearing loss is greater than 90 decibels in both ears would be considered deaf under IDEA. To be considered hearing impaired under IDEA, the decibel loss would need to be 20 decibels in both ears. Whether a student has been identified as deaf or hearing impaired under IDEA doesn't affect what services they will receive, because remember, services need to be determined by the IEP team. One other important legal requirement is that schools are required to screen children to see if there's a possibility that they are deaf or hard of hearing. Periodically, schools will do a screening of all children to determine if there's a child who has a hearing loss that has not been identified. It's important to understand that the hearing screenings will identify children for further testing if they do have a 20 decibel loss or more. If a child does have less than a 20 decibel loss, they are not eligible for any sort of special education services. So where are students who are deaf and hard of hearing educated? Let's review some of the different types of settings that are available. The least restrictive setting is the general education classroom. So students who are deaf or hard of hearing can be totally included into the general education classroom. They can be pulled out for part of the day. If it's less than half the day, then that is a resource room. They can be pulled out of the general education classroom and be educated in a special education classroom for most of the day. They can also attend a special day school in their community. And they can attend a residential program where they actually go and live and go to school. Relatively few students with profound hearing loss or deafness are educated in the general education setting. Now, more students with mild to moderate hearing loss are educated in general education settings. However, many are pulled out for part of their day for services. If you recall from the earlier discussions we've had in the class, the law of the land is based on the principle of the least restrictive environment. That means that a child should be educated alongside his general education peers to the greatest extent possible, but based on the availability of getting an appropriate and meaningful education. For students who are deaf and hard of hearing, There are many advocates that don't feel the general education classroom is the least restrictive environment for students because they don't think it provides a truly meaningful education. Here are some realities of the general education classroom that we do need to acknowledge. The general education classroom is a language-heavy environment, and a student who is not understanding the language is certainly limited to the amount of profit they can expect to glean from the education in that setting. Students with minimal or mild losses typically can follow the spoken word, and so through technology or through other means, these students can benefit from being in an environment where there's a heavy focus on verbal or spoken communication. However, when you talk about students with more severe hearing loss, they need more specialized instructional techniques and may need an interpreter. There are also special day schools that children who are deaf and hard of hearing attend, but they live at home. Today, the most common type of special school is what's called an oral school. Oral schools got somewhat of a bad reputation back in the 1800s and early 1900s because one would find these oral schools where kids were actually punished for signing. And there are horror stories where kids would get their hands slapped or they were severely punished if they used sign because the belief was that they had to teach them to lip read and to communicate using spoken language. But oral schools have changed today. Oral schools focus on preparing deaf and hard of hearing students to become functional in the hearing world by listening and using spoken language. Given that the large number of students with cochlear implants has increased their understanding of spoken language, oral schools seem to be increasing. Today, it's not just lip reading that's focused in an oral school, although paying attention to people's lips and gestures and communication is still part of it, but it's also training the ears to hear information and make distinctions and discriminations between information. 20 years ago, many thought it would be impossible for children who are deaf and hard of hearing to listen and use spoken language. However, with the recent advances in technology, such as cochlear implants, and the emergence of new oral and oral teaching methods, functioning in a hearing community is now considered to be a realistic and reasonable goal for all students. The last possible environment is the residential schools for the deaf, and this is one disability population that has continued to support the need for residential schools in the continuum of services. In Illinois, we have the Illinois School for the Deaf in Jacksonville. Residential schools tend to focus on sign language. For everyone in the school, from the teachers to the students, sign is the primary means of communication they use. Proponents of residential schools tend to stress the importance of the deaf community or deaf culture and the need to immerse deaf children into deaf culture and become proficient signers. Residential schools have a very, very strong advocate for children to develop sign as their primary means of communication and to also develop friendships with others who are deaf and hard of hearing. A key thing to remember is that residential schools and programs focus on sign, and in the United States, that means American Sign Language. So what is the best setting? Where should students who are deaf and hard of hearing be educated? In terms of inclusive settings, students learn survival and coping mechanisms within the hearing community, which is the community that they will be a part of. It's our larger community. If children with hearing losses are not given the opportunity to go to school in their neighborhood public school with hearing children and don't learn to navigate the hearing world, they won't be equipped to survive when they're adults. Excluding kids from the inclusive educational setting means that they won't have the opportunity to meet and interact with hearing peers. The opportunities to learn with hearing peers is seen as an advantage of the inclusive learning setting. The other advantage that is really stressed is that if one is in an inclusive setting, the child will be exposed to higher order academic concepts and higher expectations. The academic achievement of kids that are deaf and hard of hearing lags far below that of hearing peers. Unless the child is in a general education setting where they have other children that are pushing the curriculum forward and are learning at a high level, the child won't have the opportunity to learn the more difficult academic concepts and may not be challenged. What are the pros of more specialized settings for students that are deaf and hard of hearing? Well, because sign language is used in more specialized settings, the children understand the teachers. So how can you learn if you can't make out most of what is being said? To learn, you need a teacher who signs in order to have the opportunity to understand what the teacher is communicating and to be able to communicate back to the teacher directly and not always having to use an interpreter. Research shows that deaf children in more specialized settings versus more inclusive settings participate at greater levels in class discussions and may be more engaged within the class. When in a hearing class, many children will withdraw and not participate very much. Another major argument for specialized settings is that it provides children who are deaf and hard of hearing with a peer group with whom to interact. To meet other children who are deaf and hard of hearing that communicate in the natural sign language enables people to identify friends for life and to have a true peer group to be a part of. Children who are deaf and hard of hearing in inclusive settings feel more isolated. Being isolated means that there's less social opportunities, ranging from things like developing friendships and romances and getting one's heart broken, to developing leadership skills. All of the social dynamics that contribute to learning lessons when growing up are limited when one is isolated because not fitting into a hearing world. The final argument that's put forth is that students in specialized settings who are deaf and hard of hearing may have a much higher rate of participation in extracurricular activities. So if you go to the School for the Deaf in Jacksonville, you'll see that they have their own football team, that they have their own cheerleading squad, that they have this, and that basically all of the kids are involved in these extracurricular activities. And what you see among kids who are deaf and hard of hearing in the general education setting is that they do tend to be less confident, more socially isolated, they may withdraw, and they don't get involved in the extracurricular or social activities that kids in more specialized settings do become involved with. So those are the arguments in a nutshell for more inclusive settings versus more separate settings. This is a big controversy on which is the better educational environment. At ISU, our Department of Special Education has taken the stance that we want our deaf and hard of hearing majors to be able to teach in both specialized settings as well as more inclusive settings. So let's move on and talk about supports that can be provided to any student no matter what the educational setting is in which they're receiving services. Let's review an audiogram. Does this child who received this audiogram meet the diagnostic criteria for a hearing impairment? The answer is yes. In both their right ear and left ears, they have a 20 decibel hearing loss, and that is considered to be the cutoff point for eligibility for special education. Eligibility for an IEP is based on more than just the 20 decibel loss. For example, if there was only a 20 decibel loss in one ear and the child had normal hearing in the other ear, the child would most likely not be eligible for an IEP because the child would not need special education services and supports if that were the child's only disability. These are checklists that require consideration of what the decibel loss is at different frequencies, and the child's progress in school is always a consideration. But for the purposes of this class, we're just going to say that a 20 decibel loss in both ears and a 35 decibel loss in just one ear is affected will generally qualify a child underneath those federal special education laws. Again, in the classroom, it's just not that simple. But for the purpose of this class, we'll just go with the 20 decibel or more loss in both ears if the child has a bilateral hearing loss, and the 35 decibel or more loss in one ear if the child has a unilateral hearing loss. When there is a hearing loss between 10 and 20 decibels, which is the range for a minimal hearing loss, a child would be missing a lot of key information and would definitely benefit from supports in the classroom. A student who has a mild hearing loss at about 15 decibels can miss up to 10% of speech when the teacher is further than 3 feet away. So you could expect the student to experience some difficulties in learning that other children will not experience. At 30 decibels, they can miss 25 to 40% of the speech signal. At 35 to 40 decibels, they will miss at least 50% of class discussions. They will miss consonant sounds, especially with high frequency losses. That's a lot of information that a student could be missing with only a mild hearing loss. Now let's talk about a moderate loss. Students with a moderate hearing loss understand conversational speech at 3 to 5 feet only if face-to-face, and if the structure and vocabulary are controlled. This student will miss 50 to 75% of the speech signal at 40 to 45 decibels, and an 80 to 100% with 50 decibel loss, and is likely to have delayed and defective syntax, limited vocabulary, imperfect speech production, and an atonal voice quality. A student who has a severe hearing loss may hear loud voices about 1 foot from the ear. With amplification, a student should be able to identify environmental sounds and detect speech sounds. If the student's losses happened prior to them developing oral language, so it was acquired hearing loss, then most likely the oral language and any speech may not develop spontaneously, or it may be severely delayed and impacted. And for a student who has a profound hearing loss, they may be aware of vibrations more than tones. Also, most rely on vision rather than hearing as a primary avenue for communication and learning. Speech and language does not develop spontaneously. Think about the things in your home that you would have missed this morning if you couldn't hear. What about the classroom? Even if we're only thinking of a student who has a small hearing loss, the classroom could be a problematic environment for the student. In most general education classes, hearing and listening are a cornerstone for the educational system. If a child cannot clearly hear the teachers, then the child is going to be at a disadvantage. There are several technologies that have been developed in order to help deaf and hard of hearing students with listening and hearing. The first and most well-known is the hearing aid. A hearing aid amplifies sound from the environment into the wearer's ears. The device makes sounds louder, but it does not make it any clearer. A hearing aid amplifies the entire room, background noise and all. Many popular styles are currently available. A few of them are behind the ear, and in the canal style of hearing aids. Behind the ear hearing aids have a component that settles in the outer ear and a component that rests over and behind the outer ear. An in-the-ear hearing aid only has a component that settles within the outer ear. It is similar to looking like an earplug when worn. In the canal hearing aids are small and sit in the ear and the ear canal and are very hard to see. Another helpful technology is the FM system. An FM system will amplify the voice of the speaker directly to the student. This is helpful as it filters out unnecessary background sounds, making the message more accessible. The sound field system is similar to the FM system, except the sound is amplified to the entire room, not directly to the student. A cochlear implant is a fourth technology that has been developed. It's a surgical procedure. Once complete, the cochlear implant will stimulate sound and hearing directly to the wearer. The cochlear implant will transmit the sound of the person speaking and also background noise. The cochlear implant is the subject of much controversy within the deaf community today, as it is a surgical procedure geared to fix deafness. Remember, people within that deaf community do not feel that deafness is something that really needs to be fixed. Let's talk a little bit about communication. When you're referring to communication, it's really important to know about the three components of communication. There's the sender, that is the person speaking and trying to communicate with another person. Then there is the receiver. That is the person trying to understand what is being communicated. The final component is the message. The shared message is the information trying to be communicated and understood by all parties involved in the information exchange. When educating deaf or hard of hearing students, there are several different communication methods that may be used. The first is manual form of communication. That means a visual form of communication both expressively and receptively. American Sign Language is the natural language of the deaf community. American Sign Language has all of the necessary components to be recognized as a legitimate language. There are other modes of communication which are visual in nature, but they are not true languages. The second method is called the oral method. This method does not use a visual form of communication and relies strictly on the use of speech and hearing. The oral method of communication uses spoken English, Spanish, or any other spoken language to communicate. The deaf and hard of hearing student uses verbal means for expressive communication and auditory means for receptive communication. There is no manual component to oral methods. There are two other forms of communication that are not manual or oral, but more a combination of both. These are called simultaneous communication and total communication. Simultaneous communication and total communication are better described as a teaching philosophy than a communication mode. These two philosophies are often confused with one another. Simultaneous communication uses manual and oral communication modes at the same time, thus the term simultaneous. An example would be to use spoken English and signed English at the same time in order to communicate and convey your message. Total communication is using whatever means are necessary to get your message across clearly. Oftentimes, this does include a means of simultaneous communication where someone would be using sign language and spoken English at the same time. With total communication, however, sometimes just an oral method would be used in isolation to communicate, and at other times just manual methods. In addition to oral and manual methods of communication is isolation or simultaneously. Total communication would also include using technology, gestures, acting, and other means in order to communicate most effectively. There are many factors that can impact the quality of communication, of which one needs to be aware for a student who relies on auditory or oral methods of communication and speech reading. The first factor that we are going to address is that of the individual with a hearing loss. These factors may impact a student's ability to focus and be receptive to learning. Therefore, it's important to consider the person's hearing loss. What degree of a hearing loss does the student have? What type of loss do they have? Is it unilateral or bilateral? Also, you'll want to take into consideration any amplification that they may be using. Does the student wear hearing aids? If so, are they wearing their hearing aids? Is the battery dead? Do they use an FM system? Does it work properly? Also, consider the language of your instruction. Is it technical, jargon, slang, or common? Is a child familiar with this type of language? Do they have the experience with this language or topic? Some schema from which to build from. The child may need to be taught coping skills or may already have quite a repertoire. It is important to know what of these skills the student possess and which they do not. Many of these skills need to be explicitly taught and practiced in a variety of settings and subjects. Also be aware of the type of the day. Is it cloudy and rainy or bright and sunny? Consider the student's mood and their health. Is he or she sick? Are they tired? Upset because the family dog was put to sleep yesterday? Again, all stressors that may impact a student's ability to focus and be receptive to learning. The final individual factor that I want you to address is that of intelligence. Some deaf or hard of hearing students are diagnosed with additional disabilities that may impact their cognitive abilities, and then others are not impacted by this. Not every deaf or hard of hearing student has a below average IQ. On the other side of that, not every deaf and hard of hearing student has an average or above average IQ either. So you need to consider, what is the student able to learn in the environment in which they're in, and are they ready to learn? Other factors to consider are those of the person with whom the deaf or hard of hearing student is communicating. Whether the person is a man or a woman will influence the ability to decode the message. Do they speak in a high or low pitch voice, fast or slow? What is the structure of their face? The canter in which they speak? Is this person familiar or unfamiliar to the deaf and hard of hearing student? Often people who are familiar with each other get used to the way each other talks and listens. Familiar people develop strategies and an understanding, as well as a level of comfort and patience. Age can also be an important factor. A young child may not have as many patience as a more matured adult. Child-to-child communication is often more challenging and stressful for a child with a hearing loss than communicating with adults. The size of the group can have an intense impact on a student that is deaf or hard of hearing's ability to communicate. The larger the group, the less success with communication. Small groups and individual conversations prove to be best. Accents and dialects can also be a challenge. Environmental factors are often overlooked. Be considerate of the acoustics in your room. Is there any type of echo or carryover from another room? Are the floors tiled or carpeted? What materials is the ceiling tile? The more soft material in your room, the better acoustic environment. In addition to the acoustics and echo, be aware of other noises that may be distracting. Does the fan make noise? Is the overhead loud? Another class walking to the library? Even something as minute as a ticking of a clock can be intrusive enough to skew the message. The arrangement of the room, and especially the seating arrangement, needs to match the type of learning that needs to occur. Depending on the type of learning, teaching and discussion should impact the arrangement of the room for each lesson. What will work best for what you're trying to accomplish? Rows, circles, or clusters? Be sure that the student who is deaf or hard of hearing is near the source of the message. All of these environmental factors will vary from one location to the next. Be prepared for the deaf and hard of hearing student to be more challenged in places such as the gym and cafeteria, as well as on the bus and field trips. Lighting can greatly improve or hinder communication. Adequate light is not too bright or not too dim will decrease the stress on a student who is deaf or hard of hearing's eyes. The deaf or hard of hearing student's eyes are very sensitive, as that is the primary means of their listening and learning. Being conscious of that and the light will be helpful for the success of a student who is deaf or hard of hearing in your classroom. When communicating with a deaf or hard of hearing person, there are several things that you can do to help make that interaction easier and the message more clearly understood. When you're communicating with a student who is deaf or hard of hearing, be sure you are facing the audience. Do not turn your back while speaking. If you are using a black and white board, speak your message and then turn and write on the board, or vice versa. You need to be conscious not to cover your face. This includes being aware that your hair is not in your face or a paperclip is in your mouth. It is essential to maintain eye contact with the student who is deaf or hard of hearing, because that is the social clue indicating that someone is talking. Deaf and hard of hearing students rely upon it heavily to know when to pay attention. As speech reading and visual cues are an important component to accessing the spoken message, keeping minimal or no facial hair is also helpful. In the same regard, avoid heavy makeup and busy clothing so that the student who is deaf or hard of hearing may focus on the message at hand. As was addressed earlier, lighting is very important. Lights which are too bright or too dim cause excess strain on the eyes of a student who is deaf or hard of hearing. Be sure the area in which you are communicating is adequately lit. If there are bright lights or a sun-stricken window, stand away from it. Bright lights behind a speaker can cast shadows, which will inhibit the student who is deaf or hard of hearing's ability to read your expression and speech. In addition to lighting, clear the area of any obstructions that will limit visual input. This could be something as simple as the ketchup bottle, napkin holder, or centerpiece. In deaf culture, it is extremely rude to break eye contact in order to respond to noises or calls outside of the conversation without first notifying the deaf or hard of hearing person. There are many things that can be distracting to a student who is deaf or hard of hearing. Please take the time to be aware of these things within the environments in which you interact. Deaf and hard of hearing students get most of their information visually, and any auditory input they are trying to make sense of by attaching a visual component. Deaf and hard of hearing students are often reprimanded for being off task by looking around the room or looking up from the seat work they are trying to complete. It's essential to understand that the other students in the room can maintain a sense of awareness of their surroundings auditorily, while the deaf and hard of hearing students can only do so visually. This skill has to be developed within them as a survival and coping skill. In regards to one's speech while communicating with a student who is deaf or hard of hearing, there are a few do's and don'ts. Do face an individual and speak at your normal rate and volume. Don't overemphasize or exaggerate your speech sounds, as this will only distort your message. Do be expressive with your facial and body expressions, as well as supporting them with any visual means that may be possible. This is your toolbox, or what I like to call your bag of tricks. If you are aware of what your backup options are and are prepared, communicating with a student who is deaf or hard of hearing will be a lot easier. The first thing that will help facilitate the conversation is limit your topic. Be sure to inform the deaf or hard of hearing student what you'll be talking about. If you're trying to decide on a restaurant, tell them that. Having that piece of information will allow them a smaller set of choices when deciphering what you might be saying. Having a limited set of choices allows for more accurate deductive reasoning and closure than an unlimited one. Another way to limit the choice set would be to ask yes or no questions. Be warned that deaf and hard of hearing youth often respond yes when asked if they understand, even if they don't. Ask specific questions to check for comprehension and have the deaf and hard of hearing student repeat directions or information back to you. When communicating with a deaf and hard of hearing student, it would be prudent to have a pen or paper available. However, be careful not to assume that the student who is deaf or hard of hearing can understand all of what is being written, or that they will be able to effectively communicate back to you in writing. Also, be sensitive not to assume that all deaf and hard of hearing students cannot communicate effectively via written means. How a hearing loss affects each individual is just that, individual. It is important to know the person with whom you are communicating, their strengths and challenges. English is not their native language. English is an auditory and oral language, not a visual one, making it difficult for a student who is deaf and hard of hearing to master. Deaf and hard of hearing students are English language learners. Don't be afraid to be dramatically expressive. Use your best acting skills. The more visual you make your message, the better understood your message will likely be. We are lucky to be living in an era of extensive technology development. Be familiar with technology and what options it provides, and how to use a variety of technology tools. One commonly assessed technology tool is a cell phone. A hearing person could use a cell phone to send text messages to communicate with a student who is deaf or hard of hearing, or just use text messages to use the text message screen to facilitate written communication without pen and paper. Laptops can also be used in much the same way by sending email or typing messages back and forth in Notepad or some other word processing program. The TTY is the telephone used by the deaf and hard of hearing. It looks similar to a typewriter. A deaf or hard of hearing person connects it to a phone line and can directly communicate with another deaf or hard of hearing person who owns a TTY. If the deaf or hard of hearing person is trying to call a hearing person, then they would use a relay operator. In this instance, the deaf or hard of hearing person would type the message, the operator would read it, and the hearing person would orally respond, and the operator would type the message back to the DHH person. A video phone much the same way as a webcam and a TTY. A DHH person can communicate directly with another DHH person using a video phone. The difference between a TTY and a video phone is that the video phone allows for sign language communication instead of written communication. If the deaf and hard of hearing person needs to call a hearing person, they use the video relay operator. In this instance, the deaf and hard of hearing person would sign the message, the operator would take it in and translate it into spoken English, and the hearing person would orally respond. The operator would sign the message back. Interpreters are people who know sign language and can help with communication in a variety of settings. When showing movies in class, be sure that the movie has closed captioning on it and it is displaying on the screen properly. Also, although this is helpful, simply having the captioning on may not be enough for some deaf and hard of hearing students to have full access to the information that's being presented. We'll talk more about supports that can be put into place to support a child who is deaf or hard of hearing in the next and final lecture covering students who have a hearing loss.